So the question is, am I having a heart attack? So there are the risk factors. If one has had a heart attack before, you're at higher risk. Anybody here used to smoke? 2 people used to smoke. Any more? No? Okay. 3? Yeah, me too. I used to smoke.
What was your question?
How many people here used to smoke, have quit smoking, but used to be regular smokers? How many people are smoking now? I bet you none, but you never know. Okay, so that's good. But you see that it used to be about 60% of Americans used to smoke back in the 50s and 60s. Then it went down to 30 or 40% in the 70s, then down to 30% in the 80s, and now it's almost 20%. But it's still too high. 20% is 1 in 5. So those are all preventable, because smoking increases the risk of heart attack by 2 or 3-fold. So we want everybody to stop smoking, or talk with your kids or grandkids, because they're the ones who are smoking now, and they're going to cause the problems later. So I know they don't like to be bothered, and I know everybody wants to be on their own, and don't tell me what to do. I got a daughter, I know all about it.
If you look at the old movies, they're all smoking.
Exactly. And now hardly ever, but still, even in some of the newer ones, it's still considered a little bit cool, a little bit of a rebel. But the problem is that it kills people. So it's a sure killer. It contributes probably to 400,000 deaths a year in the United States still. And worldwide, it's actually an increasing problem, because in Europe, probably around 60-70% of adults still smoke. And in China and Japan and some of the developing countries, a lot of people are smoking. So that's one major risk factor. If you're having chest pain and you're a smoker, you may be having a heart attack. If somebody in your family has had a heart attack, you're at a higher risk. It's a family history. But that's not as important as diabetes or even the age. As we get older, we are at higher risk for heart attacks. And male or female doesn't really matter as much as we get over 65 or 70. The rates become almost equal over 65. But in younger patients, more men have heart attacks than women if they're under 65 in general. But the symptoms may be a little different. But if somebody's a male or a female, we're both at equal risk for heart attacks as we get into our 60s and 70s. Next slide, please. So here's what you want to look out for. Everybody knows about chest discomfort. Yeah, this is just, I think it's a battery, but I don't know if you have another one. Anyway, I'd like to be able to point, but you guys can see the slides there. Chest discomfort is, everybody knows that, but it doesn't have to be pain. It doesn't have to be a heavy pain. It could be burning or pressure. It could feel like gas that you have to burp. And it's something unusual. Most people can tell the difference between a regular burp and something different, something really that doesn't feel right. And you got to listen to your body and really go with it.